State says Dr. Michelle Fiscus got fired for ineffective leadership and poor relations with co-workers.
Dr. Fiscus says this is all about the vaccine and that she got fired because Republican lawmakers don't like the message. Fox 17 News' Amanda Chin live downtown at the health department after digging into some new emails between the health department leaders and Dr. Fiscus. Good evening, Amanda.
Good evening. These new emails I have in front of me continue to show health department leaders pushing back on Dr. Fiscus's recommendation for vaccine outreach for teenagers. It's been 1 week since state health department leaders fired Dr. Michelle Fiscus. New internal emails show the state's health commissioner pushing even more to end vaccine outreach for children. In this email exchange, Dr. Fiscus's manager says, quote, Commissioner Piercy has reiterated the following a couple times this week. Quote, it's hard to overemphasize the need to lay really low right now on all things kid related, end quote. Dr. Fiscus pushes back and replies, saying they are required to do reminders regarding routine vaccinations. I've reached out to the state health department through email about half a dozen times this past week, asking them to respond. A spokesperson continues to tell me they will not be commenting further on personnel matters. In a memo obtained by Fox 17 News through a public records request, the chief medical officer says they fired Dr. Fiscus because of her management style and ineffective leadership. But Dr. Fiscus says they fired her because she wanted to encourage teens to get vaccinated. Meanwhile, Dr. Fiscus defends the work she's done in her former role.
Any person can go within 15 minutes of their house in the state of Tennessee and access a COVID-19 vaccine right now if they chose to do so. This is because of the gagging of the Department of Health and our inability to message the importance of this, the control of all of the communication by the governor's office.
Off duty and out of jurisdiction former police officers' actions are calling into question the hiring practices of the Deckard Police Department. In a one-on-one interview with Fox 17 News, the driver held at gunpoint for speeding says change is needed at the top. Fox 17 News' Maggie Lemire joining us from Deckard after working to get a response from Chief Ross Peterson. Maggie.
Former police officer Matthew Ward's actions of performing an off-duty traffic stop is calling some to address the person at the very top, Ross Peterson.
Not on duty. You can't. Doesn't matter. I am on duty 24/7.
Video showing former Deckard officer Matthew Ward pulling a gun on a man and his pregnant wife for speeding. More than 1 month later, driver Ilya Kovalchuk says there is not a day that goes by where he doesn't think about the traumatic incident.
I thought that was it. I thought this is it.
Kovalchuk spoke at last week's city board meeting where he raised concerns regarding how Officer Ward was originally hired.
Ross, did you contact the officer's previous employer?
No.
Now the soon-to-be father says his main goal is to get the city to make a change starting at the top.
I'd prefer, I don't know if it's right, to see Ross Peterson fired and replaced with somebody that will call your previous employer before he gives you a gun.
Fox 17 called and emailed the police department with no word back. We traveled to Deckard as well, where we spoke with an officer who said he'd pass along the message.
We just want to hear from him.
Get on the ground! Police!
As for Kovalchuk, who says he still experiences the effects of what happened, justice, change, and what could have happened still weigh on his mind.
He could have accidentally blown my brains out, and that's what really scared her, was that not only was she going to lose me, but she was going to have to raise this child on her own.
A stunning $18 million no-bid contract for 1 semester of COVID support and services. That contract raised so many questions. And now that the invoices are actually in, believe it or not, there may be more questions than ever.
The invoices for the Meharry Medical College Ventures came every month. No detail, no line items, millions of dollars of condensed invoices. Items like conduct, train the trainer meetings. No dates, no hours, no number of people trained, no number of trainers, just a flat rate of $245,638.95 a month. $1 million of training with absolutely no explanation and 1 invoice to go. School board member Fran Bush says her phone has not stopped ringing.
I've been contacted by so many parents that are really, really concerned about their tax dollars. How could this have happened? Why did the district and the superintendent allow these charges to be approved when they were so egregious?
We know that Nashville Public Schools paid for a COVID monitor in every school. How much did that cost? How much did we spend on their individual training? MNPS substitute teacher and parent Lauren Herring saw a lot of the monitor at Greenbrier Elementary School. Here's what she witnessed.
In the mornings, she would move the monstrosity of the temperature scanners to one of the entrances, and kids would just come by. My son said he never stopped at one. He was never told to stop at one. And that school had 3 different entrances, 1 temperature scanner. So it's not even getting a third of the kids who come in.
And that was just before the bell. What about the rest of the school day?
They were just roaming the halls of the school. The elementary school where my son goes, that woman who was delightful, very nice, lovely, she volunteered to work in the cafeteria because she had nothing else to do.
There was also quite a bit of money spent on nurses, but just try to find it in these invoices. MNPS Chief of Staff Hank Clay brokered this contract with Meharry Medical Ventures. School Board member Fran Bush says she asked him directly what taxpayers were paying these nurses.
And I said, so I hear we're paying $300 an hour? $300. He said, well, what do you think we should bill for? He asked me that question. About $45, $50 an hour maybe, but $300 an hour? How do we come up with that number? And he said, well, he couldn't answer the question.
The original contract says MNPS agreed to pay nurses $125 an hour, but there's no reference in the invoice for how many nurses, how many days, how many hours. We're trying to get answers. I emailed MNPS school spokesman Sean Braystead 2 weeks ago. I have to ask you if MNPS is satisfied with this type of invoice. There's literally no detail. Let's look at just one category, training the trainer, a nearly $250,000 recurring item every month. How many trainers were there? At what hourly rate? How many people were trained for how many hours? Is there not a more detailed line item invoice? He never answered. I tried again Friday. I've noted that you did not answer my last email. Please don't take us down this path. Let me try again. Why didn't MNPS ask for more detail in these monthly invoices? There are no dates, no hours, no amount of people, no detail. There's no line item. There is no line item explanation for millions of dollars in expenses. Why didn't you require detailed billing? Why am I asking these questions? Shouldn't MNPS, under basic due diligence and good stewardship, require a detailed explanation of how this money was spent? Thank you for your attention to these important questions. They are not just my questions. MNPS parents and taxpayers want answers. MNPS answered this email by sending me the original contract before billing, a contract that promises, quote, variable monthly expenses. Items shall be billed monthly and itemized in accordance with the schedule below. Well, where's any of that? We're still waiting.
School Board member Fran Bush promises to demand a line item presentation, not of what was promised, but what was delivered. Number of people, hours, actual work done, all of the things you would expect from a contract of this magnitude.